My name is Jean Knudtson, and I live on a farm near Volga, South Dakota. Some of my hobbies that I have, one is with my husband. I do woodworking craft projects with him. I make handmade cards. I visit the elderly, which I really, really love doing. And I crochet a lot. Well, my vision was getting worse, especially at night. It was like a sparkling look when the cars would meet you on the road. And I just had a hard time seeing things. And then my sisters, two of them, actually had it done shortly before I did. My doctor, the regular optometrist, Dr. Jans, thought I should go over and see Dr. Knudtson in case I needed cataract surgery. Very warm. He liked to have questions asked and explain things very well to me. He had an awesome staff. They too answered the questions I had. No question was stupid, which made me feel very comfortable. I lived in Sioux Falls area for a long time. I had my doctors there for like 30 years. And when I moved to Volga 20 years ago, it took me a while, but because of my doctor that I found here, Katie Jones, she really recommended trying to get doctors around here, which, yeah, I should have done that a long time ago. Because the doctors that I have come across here in the clinics and in the hospitals are excellent. They're very willing to help and explain things to you when you have questions. I feel it's much better for us. If I would end up in the hospital or even going to the clinic, my husband could take off work there and drive into Brookings versus driving all the way to Sioux Falls, taking a whole day off. And relatives coming to see you too if you were in the hospital, they would be more apt to come to Brookings than they would Sioux Falls. I have issues getting IVs, and usually they hit like 3 or 4 times before they can get one in. And I remembered that they had a nurse here 3 or 4 years ago that she got it the first time. So I described the nurse. They found her. So it made me feel very comfortable and very appreciative to go that extra mile and that to find that nurse. They carried on conversations with me to help relax me, which it did. You know, the nurses there, they would answer the questions I had, and maybe it's because I'm getting older, but I don't have a problem asking why. So, yeah, they were very helpful. It was like a new world. I could see things even without my glasses. I could see things far away that was 20/20 vision. Yeah, I'm really glad I did it. Yes, I did. I noticed that I did the right eye first, and they had told me that you're going to notice right away on your left eye, it's a yellow film versus what's over here. That's how much clearer and brighter it was. And yeah, should have done it a long time ago. I was able to drive more at night, which my husband really appreciated. And the vision, I could sit and watch TV without having my glasses on anymore. Their willingness to go above and beyond to help me, like the IV situation. Dr. Knudtson had said, no question's a dumb question. And their knowledge to me is much better than what mine is, but they were able to explain it on a level that I understood and my husband understood. So that's what I really appreciated. I would highly recommend the clinic system here in the hospital system because of the fact that the treatment that I got, I was relieved when I went home. I wasn't scared like I was initially coming in, especially to a newer place. But sometimes not always being so big is not a bad thing, because the quality of service that I got, the medical attention, was very much appreciated. I saw what it did for my 2 sisters. To think that, I can actually drive at night and not have those big glare lights at me, and I would feel safer. So I would definitely recommend it to anybody to have it done.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.